What is autoimmune disease? At its very basic fundamental level, what is it? Today we want to peel back the layers of mystery that shroud autoimmune disease. Do you suffer from Hashimoto's thyroiditis, or rheumatoid arthritis, or Crohn's disease, or lupus, or psoriasis, or Sjogren's syndrome? If so, you have an autoimmune disease, and you've probably been told that by your medical doctor. But what often isn't explained to you is what exactly autoimmune disease is on a very fundamental level and what can be done about it. You're left to go Google and find things out for yourself. Well, today we want to do an Autoimmune Disease 101 video to help you understand really what's going on in your case and where to go from here. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. So what is autoimmune disease? And are autoimmune diseases different? So is Hashimoto's different from RA? Is RA different from Crohn's? Is Crohn's different from Sjogren's? The answer is yes, they are different in terms of what tissue is affected, but they are all connected in the terms of what is the fundamental problem. And the fundamental issue is immune dysfunction. A primary immune dysfunction is the underlying fundamental driver of your autoimmune disease, whether it's lupus or psoriasis or Hashimoto's or RA or whatever name we want to put on it. Oftentimes in the mainstream medical model, you'll be given a diagnosis, Jane, you have Hashimoto's thyroiditis, and then you'll be given a drug. Jane will give you Synthroid. And they'll give you that drug to palliate you until there's been enough damage to the end organ that a procedure needs to be done, mainly a surgery. Well, that's not really great care because that's basically watchful waiting or allowing the process to continue until you're so destroyed that, okay, now we'll take your thyroid out. So what can be done and what is ideal care for this issue, which is autoimmunity? Well, here's the key. We already said it. Autoimmune disease at a fundamental level is immune dysfunction. So the Humira for the RA or the Synthroid for the Hashimoto's are doing nothing to affect the primary process, which is immune dysfunction. Those are addressing the result or the effect, which is the tissue damage. So you see the difference between all of these is really the tissue being affected. They are all immune dysfunctions or an immune imbalance underlying each of them, and the difference is as unique as the person that's being affected. The difference is the innocent bystander or the different tissue being affected in the different people. So there are different immune mechanisms to different autoimmune diseases, but fundamentally, again, it's an immune imbalance that needs to be teased and nuanced out, and the immune system needs to be addressed, not the innocent bystander, right? So if we make this an analogy where the tissue being affected is the innocent bystander, and the real criminal is the immune system, then the mainstream medical model is always letting the bad guy go and tackling the innocent bystander or addressing the innocent bystander. Why don't we tackle the bad guy and then the innocent bystander will stop screaming for help? Make sense? So again, the drug is not doing anything beneficial most of the time to affect the immune system. It's just helping with symptoms. So Humira may decrease RA flares and pain, but Humira is dropping the curtain on the whole symphony instead of saying, hey, leave the curtain up, but let's talk to the percussion area and say, you guys need to pick up the slack. And that way we address the specific pathway in the immune system that has gone awry in RA, but we don't drop the curtain on the whole show and raise risk for tuberculosis or cancer. So again, repetitive, but it's very important to know and to start with this understanding, is that your autoimmune disease, whichever one it is a primary immune imbalance or dysfunction, and the result of that immune imbalance or dysfunction specific to you is the specific tissue being damaged, whether it's thyroid or joints or parotid glands or skin, etc., etc. So in your path to dealing with and living with your autoimmune disease, you want to first understand what's the primary driver, and that's immune dysfunction. And by understanding that, you can figure out strategies to live in a way that supports healthy immune function, and work with a practitioner to work with care strategies to support optimization of whatever immune imbalance or dysfunction is underlying the disease that's been named. So again, we want to tackle the perpetrator so then the innocent bystander can stop screaming.